So, what are the clinical course of tetanus, diphtheria, and pertussis? So, Clostridium tetani starts when the spores enter through the body through a wound. So, the incubation period of tetanus varies between 3 and 21 days. In anaerobic conditions, the spores germinate and produce the tetanus toxin, and then the toxin enters the peripheral nerve endings and travels to the spinal cord and the brainstem. So the toxin then blocks the release of inhibitory neurotransmitters, causing muscle spasm. So tetanus is diagnosed on the basis of clinical features and does not require laboratory confirmation. So tetanus symptoms can include jaw cramping or the inability to open the mouth, muscle spasm, often in the back, abdomen, and then extremities. These sudden painful muscle spasms often triggered by sudden noises. So other symptoms are trouble swallowing, seizures, headache, fever, sweating, changes in blood pressure, or fast heart rate. So in neonatal tetanus, symptoms include muscle spasm, which are often preceded by the newborn's inability to suck or breastfeed and excessive crying. So next, diphtheria. So it starts with the colonization of Corynebacterium diphtheriae in the nasopharynx or skin, followed by the production of a potent toxin that damages the tissues and can spread systematically, causing various complications. So local effects. So we have the pseudomembrane formation as seen in the red arrow. So the toxin causes tissue destruction and formation of a gray leathery pseudomembrane in the throat, which can obstruct breathing and swallowing. So exudative pharyngitis or non-toxin producing strains can cause mild to severe exudative pharyngitis. So so we have the local and then the systemic effects seen when the toxin spread. So the toxin produced at the site of the infection is absorbed into the bloodstream and distributed to other tissues and organs, leading to organ damage. So the toxins that are released can damage the heart, which we can have myocarditis, the nerves, so we have polyneuropathies, and then kidneys, nephritis. So we go now next to pertussis. So the infection starts by inhalation of the bacteria and adhesion to the ciliated epithelial cells in the lungs. So the multiplication of the bacteria increase in the secretion of mucus. So the incubation period, as you can see here in the right, so it's an average of 5 to 10 days, but it can go as long as 21 days. Okay. So next is the catarrhal phase. You see here in the disease progression. So catarrhal phase duration typically lasts 1 to 2 weeks. So symptoms present similar to a common cold, including runny nose, sneezing, low-grade fever, and mild coughing. So if you notice on the left side, so the steps 1, 2, 3. So one is the transmission of the bacteria by aerosols, and then adhesion of pertussis on the ciliated epithelial cells, and then multiplication of the bacteria. So this happens in the incubation and catarrhal phase. So we go now to the paroxysmal phase or stage. So the duration usually lasts 1 to 6 weeks, but can extend up to 10 days. 10 weeks. So during this period, there is paralysis and destruction of the ciliated epithelial cells and secretions of other toxins. So this is this. If you look on the left picture, so it's the number 4, and then also the number 5. So symptoms present. So if you have this one, so symptoms presents uh, in a pattern. So starts with coughing fits, rapid forceful coughing spells, and then after those coughing fits, you get a whoop or a high-pitched whoop sound during the inhalation after the coughing fit. Then you have the post-tussive vomiting or vomiting after the coughing. And then you had the last typical symptoms presentation is the exhaustion. So the coughing fits can be very tiring. So remember, the patient is contagious during the catarrhal and the paroxysmal stage. Okay, so catarrhal and paroxysmal stage. And then on the last stage, if you look again back here in the right side picture, so convalescent stage. So during this stage, the symptoms gradually improve, but coughing may persist for weeks or even months. So why is Tdap important? So we go back to the epidemiology. So the number of tetanus cases, so tetanus first, no? So the number of tetanus cases, as you can see here, have decreased over the past decade. Tetanus remains to have a high incidence and mortality rate in the Philippines. But as you can see, as described here by the black arrow, so it's slowly going down. So hopefully the status improves for the next following years. So in 2018, the Philippines experienced a diphtheria outbreak, seen in the green arrow, with the Department of Health reporting 197 cases and 47 deaths by October 5, 2019. So highlighting the need for strengthened vaccine coverage and antitoxin availability. So in this data, it's from WHO. So the numbers or the data seems higher than the DOH report. So in 2018, the Philippines experienced a pertussis outbreak with 339 reported cases and an incidence rate of 3.1 per 1 million population. So in 2023, the Philippines experienced a significant increase in pertussis, whooping cough cases with a 1,495% rise compared to the previous year, reaching 622 cases by November 11th and resulting at least 46 deaths. Again, this data is from WHO, which shows lower count or lower cases compared to the DOH report. So the CDC recommends, vaccine indication. So CDC recommends one dose of Tdap for the following: all adolescents, for all women during pregnancy. So it's given 27 to 36 weeks of each station. And then we have for the healthcare personnel who have never received Tdap and who have direct patient contact. And last is the adults who have never received Tdap should receive single dose of Tdap. So in passing infants and young children, CDC recommends DTaP for all infants and children younger than 7 years of age. So we go now to vaccination. So just passing the dose of DTaP for the younger than 7 years, seen in the arrow, is given at 2, 4, 6, 15